The pandemic has left the world battered, economies have crashed, medical infrastructure is crumbling, and now the world is falling short of life-saving drugs used to treat HIV/AIDS. In a survey conducted by the World Health Organization, it was revealed that more than one-third of the world was at high risk of running out of life-saving drugs that treat HIV/AIDS. There are a total of 73 countries that face shortage of drugs, including 24 of whom have critically low supplies of the vital antiretroviral.
We were already off track for the 2020 targets, but COVID-19 is threatening to blow us completely off course. Therefore, we must take note and ensure that countries that have a high burden of HIV and are facing COVID are able to fight on both fronts at the same time.
And over the last few years, the annual number of new HIV infections has significantly dropped. But there are still more than 25 million people who are in need of these drugs to fight the lethal disease. Last year in 2019, it was estimated that close to 8.3 million people from 24 different countries were on antiretroviral drugs to fight HIV/AIDS. But today, with the sudden blockade of borders and air travel due to the COVID-19 pandemic, the supply of the drugs has been severely affected. The supply has also taken a hit as there are more than 100 vaccines and drugs that are currently under trial to fight the novel coronavirus. In a race to find an effective cure, most laboratories and hospitals are also testing and administering antiretroviral drugs such as lopinavir, ritonavir and darunavir, which are used to treat HIV/AIDS.
So in many countries, the people who have been delivering services for HIV are being taken over to fight COVID. That is a loss. So that's one way. So we're trying to say, look, find creative ways to keep people working on both. Then secondly, there are disruptions because of lockdown measures. Borders are closing. Public transportation is curtailed. So commodities are not moving easily from one place to another. Supply chains are disrupted.
In a statement, the World Health Organization's Director General, Dr. Tedros Adhanom Ghebreyesus, termed the survey as deeply concerning and said that the world could not afford to let COVID-19 undo the achievements as a response to the pandemic. Earlier, the WHO also developed a guidance manual for countries on how to maintain essential health services despite the ravaging pandemic and called for policy changes that would allow HIV patients to get the prescribed drug for longer periods of time. The World Health Organization will also be presenting the facts about this issue at the International AIDS Conference. It will highlight methods that need to be adopted to balance out medical treatment to all patients who have been impacted by the pandemic.